Now, if you're just tuning in for the first time, well, we have had an incredible lineup of guests so far. And if you missed any of them, then you can visit f4cp.org/ChiroThon. where you can watch the previous vignettes, see the full schedule, and get an update on the donations, or make a donation. That's one of the things that we're trying to do today. We're trying to raise our goal, and we're actually very excited about it. Speaking of donations, I want to share with you an update. Our current amount raised is $7,380, but we're not done yet. In fact, we have all of tomorrow, and we have a very exciting guest that I know you're going to want to meet and learn from. So the moment is coming soon. I'm going to ensure that you get to meet Dr. Sunny Kim, who is a fantastic individual. But before we get to that, I want to share a little bit about the inception of the upcoming Forbes book. Now, I talked to you about adjusted reality a little earlier in the day. And in fact, adjusted reality is currently a podcast. It's a podcast trusted by the adjusted. And we would love you to join. It's where we learn from athletes, celebrities, influencers, and healthcare professionals about how to optimize health in a fun, relatable way. That's how the book got started. And now, October 14th, it's going to be that moment where we release Adjusted Reality. Supercharge your whole being for optimal health, living, and longevity. This is what I think most listeners today are looking for. As you see, our whole day has been about health, true health, not sick care, but true health care. So, the inception of the book started with the podcast. It's moving now into learning more about chiropractic and about where we can go when we focus our time, our talents, and our treasures into building a future that is bright. Now, the past, some would say, was a pill for every ill. Well, the future now is a DC to nurture. So we're moving through the day. We're building a better way for you to look at what you're doing and how you're doing it. So when we get to the book, you're going to see that there's going to be information about the why. Why does your health matter? Because you cannot buy your health. That's one of the things that I want you to reflect on. Health today is actually an important aspect to every part of your life. As we saw Dr. Blundy talk about lifestyle and how we live every choice. It's every choice we make makes a difference. And so as this next guest is coming in, Dr. Sunny Kim, he's going to share a lot about what happens when things don't go as planned. And I think that's one of the reasons why you're tuning in is maybe your life is not going as you planned. Well, it's about choices, and those choices will in fact make a difference. But don't forget, this weekend is about showcasing all of the dollars that are currently being matched by Biotics Research Corporation. That's right. We're raising money this weekend for a very important cause, and that's to increase awareness and utilization of whole being care delivered as a chiropractor, and it's a safe, drug-free choice for your whole being health. So if you're someone that you know is looking for a healthcare solution that doesn't involve drugs, you can visit f4cp.org/find-a-doctor. We could not have had this much success today without one of our corporate sponsors. They're very generous, and that makes a difference. This particular vignette is sponsored by Excite Medical. It's a medical device company headquartered in Tampa, Florida, specializing in non-surgical spinal decompression technology. Founded in 2017 by Salim Musalam, the company is best known for its DRX 9000. That system, which is FDA cleared, is a device designed to treat chronic low back pain and neck pain caused by conditions such as herniated disc, bulging discs, and degenerative disc disease. Excite Medical is committed to advancing spinal decompression technology through ongoing research and development. In fact, this past March, Excite Medical partnered with the University of South Florida and published a study that talked about the clinical imaging outcomes of non-surgical spinal decompression for lumbar intervertebral disc lesions, a case series. This collaboration further solidifies its dedication to innovation in the field of back and neck pain management. And you know what excites me about this is really about talking about a career in chiropractic. And it's about the foundation being able to build a future that will nurture Americans and create true health. And that is why this commercial is about pursuing a career to become a doctor of chiropractic. Check it out.
As a sports chiropractor, I view golf differently. When I'm caring for a golfer, I'm adjusting their neuromusculoskeletal system to minimize injury and maximize performance for the perfect swing. Before they even step onto the course, professional golfers, like most athletes, seek chiropractic care. This is where I make the difference in the health of my patients. As a chiropractor, I maintain and restore optimal function between the spine, the nerves, and the rest of the body for that whole-in-one feeling. Where will your chiropractic career take you?
Well, welcome back. Today we have one fabulous guest, Dr. Sunny Kim. Dr. Kim is the founder and president of Progressive Rehabilitation Medicine, which was established in Cedar Rapids, Iowa in 2005. PRM has since become a nationally recognized state-of-the-art clinical specializing in non-surgical drugless and natural chronic pain relief treatment solutions. Dr. Kim originally grew up in New Jersey, attended college at Cornell University in New York, and received his medical degree from Rutgers, New Jersey Medical School. He then completed his internal medicine fellowship through Johns Hopkins University Sinai Hospital in Baltimore, and then his residency training in physical medicine and rehabilitation at Rutgers Kessler Institute for Rehabilitation, where he also served as academic chief resident. The Kessler Institute for Rehabilitation is consistently ranked among the top rehabilitation hospitals in the world. Dr. Kim is board certified by the American Board of Physical Medicine and Rehabilitation and is a fellow of American Academy of Physical Medicine and Rehabilitation. He has special interests in the non-surgical treatment of spine, sports and musculoskeletal pain conditions, and is among the early pioneers of the field of regenerative medicine and lectures across the country educating and training other physicians. I want to sincerely thank you, Dr. Kim. That's a lot. You've been through a lot. Thank you so much for being with us today.
It's good to be here. Thank you for inviting me.
Well, we have a lot to cover because one of the questions that we often have where our listeners and our viewers kind of start considering what happens when I have back pain, but what happens, for example, with you? People come in and they want to have answers to what's the cause. And for you, it's going to be the cause of failed back surgery syndrome. Can you talk a little bit about what that cause of failed back surgery is?
Sure. So typically, if a patient has failed conservative care for their back pain, which may include chiropractic, physical therapy, epidural steroid injections, their doctor may recommend that the patient go see a neurosurgeon or a spine surgeon who might recommend spine surgery. Failed back surgery syndrome is an actual authentic recognized diagnostic code for when the patient does not respond to spine surgery. So in other words, in essence, they have failed response to the back surgery.
Very good. I think that's a really important point. And I know with many things, there's obviously strengths and weaknesses of conventional pain management approaches. What are some of the conventional strengths and weaknesses of the pain management approach as it regards to failed back surgery syndrome?
Yeah, so one, one of the challenges is identifying what is truly causing the pain. And I think what's almost always overlooked is that the spinal disc itself can actually hurt. The spinal vertebral nerve in the disc can actually be a source of pain. And so the conventional wisdom for a herniated disc from a surgical standpoint is to do a microdiscectomy and a hemilaminotomy. So as you can imagine, if you chop off a piece of disc, you're left with a hole. And the surgeon will cauterize it to prevent it from leaking, but the outer wall of that annulus is still weak. So it is susceptible to reherniation and what we call leaky disc syndrome, where the chemicals within the nucleus leak out of tiny microscopic injuries that haven't completely healed. And that explains a lot of the ongoing pain patients continue to have despite the surgery.
Let's talk numbers, and I know this is a kind of a sensitive thing because there's patients all over America that have gone through back surgery. So failed back surgery syndrome, how, on a percentage wise, how often are you seeing that?
So patients come to see me when they've exhausted every other intervention. So I'll start off by saying I do see the worst of the worst. But on average, the statistics show that surgery for, let's say, a herniated disc is effective in relieving patients' symptoms only 25% of the time.
Okay.
So 75% of the time, we have essentially failed to treat the underlying cause of the pain.
It's very difficult for a patient to come in, have gone through a system that failed them, and then come back to trust and reliability. And there are different options, the strengths and weaknesses that come with every type of therapy that they're going to get. But one of the things that oftentimes a patient gets is an implanted spinal cord stimulator. Can you share what that is and how that works for those out in our audience listening?
Sure, absolutely. So the quote-unquote standard of care for failed back surgery syndrome is spinal cord stimulator implant, which is like a pacemaker for pain, where the pain physician threads a catheter wire up the spine to the area of the spinal cord that perceives pain. And then there's a pacemaker, kind of like a TENS unit, that's tunneled underneath the skin and implanted underneath the skin, and you can remotely program it to send a signal to block the pain signal. That's called a spinal cord stimulator implant. Unfortunately, the success rate for giving at least 30% relief in symptoms for something like that, where success is measured by 30% pain relief, is only 30%. Oh. So 30% of 30% gives you only 9%. So the success rate is not very high. And the reason for this is that it's very, very difficult. Could you imagine trying to thread a tiny lead up tissue that's been scarred down after surgery? I mean, to get it in the right spot is extremely challenging.
Sure.
And if you bend, twist, or lean the wrong way, that lead almost always moves out of place.
That goes beyond the threading a needle. That's impressive just to get it done first and foremost. But you know, when you think about the effectiveness and how hard it is to get that job done, what are some of the alternative approaches to treating failed back surgery syndrome?
So early on, we were one of the early adopters of true spinal decompression technology, and we discovered that when you actually treat the disc by taking pressure off the disc using true decompression technology, you get that disc to heal naturally. That outer annulus starts to heal, the nerves become less irritated, the leaky syndrome resolves, the nerves calm down, and you're actually treating the underlying cause. So yes, true spinal decompression therapy, and particularly with the DRX 9000, has been tremendous in treating failed back surgery syndrome.
So some of the audience is consumer based, and I just wanted to back up just a second because I'm like, I'm totally with you, Dr. Kim, but if there's someone out there who is significantly suffering and they know they have a disc problem, could you just go over the very superficial aspects of what does it look like when a disc starts to bulge, and what is that material that is squeezing into those fiber rings?
Sure. So your disc is kind of like a jelly donut. It has a firmer outer wall that contains the jelly on the inside. Now, if you can imagine squishy on that jelly donut, the jelly, which is kind of a softer material, will push out onto the side. That's your disc herniation. So the nucleus is more of a gel-like substance, similar to the jelly in the jelly of the donut. And the annulus is the outer wall.
Are you feeling hungry out there? Because I am now. Okay, I'll never see a donut the same way again. So with that same concept, now that we've brought the jelly donut, you owe me one after this. How does the DRX then come in to play a role? What does that look like as the same kind of parable so that a consumer can understand the difference between what they're getting when you say traction or decompression versus the special unit called the DRX 9000?
Yes, so there's a fundamental difference between motorized traction, mechanical traction, and true spinal decompression technology. True spinal decompression technology has special sensors and a servo motor and computer programming to pull in the right way. It's called a logarithmic pull. And it has special sensors to measure the tendency of your body to resist being pulled, because that's the natural tendency, and make tiny adjustments 13 times per second to bypass the body's tendency to want to resist and bypass what we call the guarding reflex, which interferes with proper decompression and can actually contribute to elevated disc pressures.
Interesting. So that elevated disc pressure then actually really does have a big impact in the healing process.
Absolutely. That's the fundamental foundation behind disc herniation, is that under pressure, and as we age, as the outer wall of that annulus starts to break down under pressure, it doesn't take much. You might bend the wrong way, cough or sneeze, and that nucleus pushes out.
So with that in mind, can you share a little bit about our discs and that jelly material? What happens as we age, and how fundamental, because you said they have to fail the conservative route. And I know you're a physician that has spent his whole life looking at the why and the how, but oftentimes you get the worst of the worst. So, and that's hard because you know the route that they had to come to get to you. What happens when a person ages, and what impact does that have on their jelly material and the donut itself?
Yes, absolutely. So in order to keep the disc healthy, you need to move. You need to move because the disc has its own circulation, and through a process of what we call imbibition, the disc will actually pump water and nutrient exchange in and out through the end plates of the vertebra on top and below. And what happens is, as we get older, we don't move as much, or we might sit too long, or we may not exercise as much. So that disc doesn't get the water and nutrients that it needs to maintain integrity of the outer wall. Then the outer wall under pressure starts to crack. And then once it cracks, little microscopic fissures occur, and then the jelly inside the middle starts to leak, and so the disc starts to dry out. That's called disc desiccation. That's a natural process that occurs, but certainly if we exercise, maintain proper posture, and use proper biomechanics, we can maintain a higher longevity for that disc.
That's the key I think everybody really needs to hear is we don't want to be a failed back surgery syndrome ever. We hope that we can have these collaborative relationships where we can discuss movement, longevity, quality of life, and what movement is. So I love that you're talking about how to maintain your body in a way so that you never end up as a failed back surgery patient. And that's a big key. Are there other things that you would say, having seen the worst of the worst, that you wish you could have told the patient before they ended up in your office?
Well, unfortunately, I don't have much of a say because they're coming to me after they've done X, Y, and Z. But I think healthcare as a whole needs to empower the patient, right? And the patient needs to be an advocate for themselves.
Yes.
And we need clinicians who will advocate for the patient. And I think that's where chiropractic can have such a profound impact on healthcare as a whole, because no one trusts their chiropractor more. I mean, patients trust their chiropractor more than the surgeon. I'm telling you right now, I see patients day in, day out. They know, they remember their chiropractor's name, but they don't remember their surgeon's name. So you have a fundamental fiduciary opportunity here to really educate and empower the patient to direct their health care in the way that is most optimal for them.
It's beautiful that you say that, and I want to give a shout out to one of my colleagues who I dearly adore, Dr. Susan Welsh, and she's at the Florida State University. What is brilliant is she's a chiropractor in the traumatic brain injury area, so that can't be an easy place to be as a chiropractor. But the best part is something you just said, Dr. Kim, is satisfaction. Is that patients really do love their chiropractor. Now, obviously we want to love Dr. Kim too, but we know you're hopefully the last outcome for us, that we want to get better before that. And what was so special about Dr. Welsh is she's received multiple Press Ganey Awards. And a Press Ganey Award is 100% patient satisfaction rates. I think it's why Dr. Kim sees that trust that is built when a chiropractor says, I think it's time for surgery. They hear it, they trust it, and then they send them to someone as qualified and gifted as you are to see those very traumatic outcomes. And I think that's one of the things that as we, as patients, want to hear their doctors working collaboratively for my best outcome. And since you kind of see them at the end and we see them at the beginning, we have to give you credit too, because that's such an important place when someone's desperate. Is there in your mind a place where failed back surgery will be a thing of the past?
Absolutely, absolutely. So if we can get more of effective disc decompression technology out there and used on a regular basis, accepted as the standard of care, to do that before surgery, I think you're going to slash surgical rates by 97%.
Wow.
I'm not exaggerating.
Wow. So we have so much more for the audience to know, is building a healthcare system that can move us away from those surgical systems and get that decompression in. 97% is significant. Then you're going to see the worst of the worst of the worst, right? At that point.
Well, I mean, we do treat patients acutely as well. It's just they need to be aware that we're there.
Yeah, that's a very good point. Aware, and that's where people have to care to know it's better to prevent than to alleviate. So we want to be in that preventative mode. And I want to thank you, Dr. Kim. What you do for your patients is critical and absolutely necessary. And I want to thank you for your kindness to be able to share with our audience that surgery is often one of those placements that happens after they have failed, and that it's not a first choice, it's usually the last choice. And if we can do the decompression first and get to that 97%, wouldn't the world be a better place?
Oh, absolutely.
Happier people, happier lives, and better quality of life.
And eliminate the need for narcotics altogether.
Very good point, because we know one thing. There is an adverse event for everything we do in life. It's a reaction. Sometimes it's really bad, and sometimes it's just an upset stomach. And the farther we get away from a dependency on a narcotic, I think the quality of life goes way up, and so does the health span.
Absolutely.
So thank you, Dr. Kim. It's a pleasure and an honor to have you on ChiroThon today.
That's my pleasure.
And I want to remind you out there listening, we've learned a lot from very gifted experts in the field of healthcare, especially as it relates to choices we make and opportunities that are available to us. And Dr. Kim definitely brought that up today. We had an incredible line of speakers today, and we hope that you enjoyed them as much as we did. Now, we do have an amazing update for all of our viewers, but first, we want to have a word from our sponsor.
As a sports chiropractor, I view golf differently. When I'm caring for a golfer, I'm adjusting their neuromusculoskeletal system to minimize injury and maximize performance for the perfect swing. Before they even step onto the course, professional golfers, like most athletes, seek chiropractic care. This is where I make the difference in the health of my patients. As a chiropractor, I maintain and restore optimal function between the spine, the nerves, and the rest of the body for that whole-in-one feeling. Where will your chiropractic career take you?
As we're wrapping up our first day of ChiroThon, we're happy to share with you that we have raised $7,380. This would not have been possible without your donation, so thank you. And we want to keep them coming in. We want you to share because sharing is caring. And this event is for you, your friends, your family, your members of an organization that you belong to. Bring them all in.
Well, and also remember that every single dollar counts, and it helps people find a drug-free healthcare. That's what chiropractic is all about. We'll be back tomorrow morning at 8 a.m. So count it, put it in your calendar. It's Saturday, so 8 a.m. Eastern time. There is no reason why you can't be with us, because not only are we going to have more guests, but if you're turning in virtually, make sure that you visit f4cp.org/ChiroThon to donate, watch the vignettes, and also make sure that if you miss anything in the schedule, see the full schedule for tomorrow's vignettes. But I know you were going to ask me about something you heard about.
Yes, I did. There is something that Dr. Fab has been, well, let's just say holding on to the end of the day. So would you share this very exciting moment with our viewers?
Well, tomorrow we're going to have a session where I'm going to, for the first time, release something I've been working on for the last 5 months, and that is a brand new book. Now, I've written 4 best-selling books. My last book did so well that I'm still very busy on that. But ever since we have a new administration, and ever since I saw that there was a movement towards root cause instead of symptoms management, when I saw that there was a support to the natural health sciences like chiropractic, that there was a support for an awareness to let people know that chronic disease is 90% of the healthcare cost, where science have shown that most of it is preventable or reversible. I wrote a brand new book. I'm going to share about it tomorrow morning. I'm going to share the idea behind where I feel chiropractic fits in this movement in order to serve more people than we've ever had the opportunity to serve in 130 years. So I'm super excited to tell you about it and have a conversation about it.
I am too, so set your alarm, because if you're on the West Coast, that's really early on a Saturday morning, but we would love you to join us. So meet us back here, 5 a.m. Pacific Standard Time, or 8 a.m. Eastern Standard. You do not.
I'll be the first one, so make sure that you don't miss that one.
You do not want to miss the very first vignette of Saturday morning. Thank you for being with us. Share, friends and family, because when they know we care, the body is aware of true health. Thanks, everyone.